Hey,
Morning.
how you doing?
Good. How are you?
Oh, I'm fine.
Good. I didn't get up early this morning, so I'm sorry I'm running behind. I
Oh
had a
gosh.
nightmare about this presentation. I was just telling Arif.
Shit.
Literally did. It was terrible. I woke up in a sweat. Oh gosh.
Oh my God. Oh, no good.
We have 93 registered, which is more than Wednesday actually.
Oh my gosh.
Yeah.
People love these 8 a.m. Friday morning meetings.
You think?
Look at Arif. He just looks like happy and ready to go.
That face. You're on mute, Arif.
I can hear you guys. I know what you just said.
I know. I know you can hear me.
Hey, does it look like I did something to the camera so they can't see the wrinkles on my face?
I mean, you do look smooth.
Somebody mentioned that yesterday. I'm like, I don't know. I didn't do anything to the camera. Maybe I did. I have no idea.
There's like
Nice.
Snapchat filters in the Zoom platform.
Yeah. Maybe I'm just photogenic.
Let's take the compliment.
Okay. Yeah. If you put up the slide deck again, I don't know why I can't see the bottom part of the whole slide. I'm trying to play with it a little.
Oops. How can I get out of that? Oh, sorry, 1 second.
Damn it, you can see my bald spots. You know, now, you know the best thing, you know, the friend of mine who's a plastic surgeon, his business is out of control right now.
I bet.
Because he said people have become so self-confident, you know, they keep looking at themselves. So this thing, this chin that I have, the tuck thing or whatever they do, it's real quick surgery. And he said it really, he looked at me and I said, you need it done.
Oh my God. I can't imagine having a friend who's a plastic surgeon. That would just mess with you so bad.
Hey, hold on, Jeff. Jeffrey.
Hey, are you confident that's correct?
What do you mean? Why isn't it?
Well, everything I've been seeing before was 9 students per classroom.
No, we've gone to 50% occupancy.
Okay.
So we can do 50% occupancy if you can maintain that distance. Absolutely. That's what.
Okay.
That's
if
what
you can mean that distance. Is that a 6-foot distance? And those yellow circles are
correct.
Are they?
Yeah.
Okay.
That's the standard.
Okay.
That's the standard. I mean, if you look at it, right, it is true because I think when you did the original 9 kids to a classroom in a 900 square feet, that's like 100 square feet, right? If you look at the 6-foot delta, I mean, the difference, if you put basically a 3-foot radius around somebody, right? What's pi r squared if r is 3, right? What is that? So that's 9 times 3, 27 square feet. Yeah, it's more than enough.
Okay.
Right? Because if you do it, you have to do it 3. So from me to my end of my circle has to be 3 feet, which is the radius. The other person's it has to be 3 feet. If you're both 3 feet radius, you actually create that 6 feet delta. Well, you need to know the area based on a 3-foot radius is pi r squared. So it's 3.14 times 9, 9,327. So it's about 30 square feet. And this person's saying, you know, and it follows the CDC guidelines for the 6-foot distancing. So I think for them to calculate based on 50 to 60 square feet per student is pretty good.
Okay. Okay. All right. It's a big change. Big change from.
It's right.
We just got this information.
Yeah.
50% guideline.
Yeah,
right?
that came in Thursday or Friday. So yeah, I think we're absolutely right to do it that way.
So then I talked to Fred last night, and kind of like you said, he said, put together a little scope.
Oh, he did?
Yeah, give me a little scope, and then we'll figure stuff out.
Oh, good,
Kinda.
good.
But I don't know if I got to be driving all over the place. I don't know.
No, Jesus Christ.
So then the other thing that Fred mentioned to me is he said, hey, we were on with the commissioner yesterday, and it was almost kind of inkling that we might be fully open in the fall.
Wow.
Okay, again, this is what Fred said before. It's wrong because there's no such thing as fully open.
All right.
Because you have the option of kids and teachers with significant health issues will be staying home. So it may not be 30% or 50% of your students. It may be 10% of your students and 10% of your teachers, which still in a small district could be anywhere from 30 kids to 100 kids.
Yep.
You know, so it's never, I think that's what people have to understand.
Yeah. Okay.
Thanks, bye.
All right. Bye.
Are you recording right now?
I am.
You can pull that out, right?
Yeah, I can crop it.
Wait, how did this? See, I was just watching. Okay, I gotta stop touching the. That's maybe what it is. There you go. That's what I was doing wrong.
Hey, Neil. I love this waiting room thing. It's so cool.
Seriously, that's amazing. I didn't know they had that.
Hey, Neil, are you sitting in a cave there with stalagmites and whatever those are?
Stalactites,
Stalagmites, stalactites.
Yeah. I decided to go with in a chilly spot. If I'm going to get COVID, I'm going to get
Yeah.
it really.
Well, I was thinking you could say I've self-isolate, quarantined myself in a cave.
Yeah, in the Fortress of Solitude. That's it.
There you go. So I think, Aaron, you said that we had actually more people now added on to this. Looks like almost 93, 94.
Yep, 93 was this morning's count, and it's not mainly ICS employees, which is good.
So it's all, yeah. Well, I'm sure we'll have some competitors, others join too, see what we're up to.
I just
Please
had someone
recommend it.
join with probably a 40-character username that makes no sense. UMNAN. Oh, geez.
UM.
Yeah, I hope it's not one of our presenters. I just don't know who it is.
Is it university? UMN?
Matt Gross is joining.
Okay.
This is Seamus. Can you hear me?
We
Yes,
can.
Sam.
Yep.
So I heard 93. I sent the invite out to St. Thomas Academy, to Visitation,
Hey, Jeremiah, I'm on that COVID call right now.
and to Tino Grace.
We'll be on for about an hour and a half or so.
Feedback, so hopefully they'll join. So there's some private school presence hopefully today as well.
Seamus, it sounds a little bit like you're in a tube. Maybe, I don't know what you can do. Maybe get a little closer. Try something else here.
Okay, hold on. Okay, how about now? Is that better?
A little bit, yeah. Yeah.
If you get closer to the mic, I think it's better.
Well, I mean, my face will be right up against the screen then, Arif.
That's fine. Just
We've got the port
Arif,
cam. Ultra high def.
Arif would prefer that I'm muted the whole time anyway.
well, I know I pay him by the word, so the less he talks, the cheaper it is.
That's good.
And then I think we'll make sure all the presenters go on mute and everything once we get on. So good morning, Matt.
Good morning.
You look like you're well rested, so you must.
Yeah, it's just it's all the makeup.
It's the filters, whatever they are on the computer.
That's right. That's right.
Can't see the wrinkles, nothing.
Yeah.
Did you take some time off or did you?
I took some time on Monday, Tuesday, and Wednesday this week. I have got some vacation days that I need to use up before the end of the month. So, yeah. Today's my last day in this office, and this afternoon will be my last day in that office. And so we're kind of wrapping things up.
What's your start day in Grand Rapids, July 1st or?
Yeah, technically July 1st. I've been heading up some meetings over there and was involved in their business manager hire earlier this morning and stuff like that. So.
Oh, good. Who did you get? Or?
Her name is Kara Linder, and she has a bunch of school auditing experience, and then some school business manager experience. So she's just what the district needs because we're in the hurt bag a little bit right now.
Yeah. Good. So do we have all the presenters on, Aaron, or the group?
We do not. No, we're missing Pat, Zemer, Todd, Jeff. I think that's it. Oh, and Matt Schultz.
Yeah, okay. So Pat, Zemer.
Can you guys see my screen with the first slide in the deck?
Yep.
Okay.
Good.
Morning, Jeff.
Morning.
Morning.
This one better be way better or we're blaming Matt Gross being on this call.
That sounds like a good idea. I got broad shoulders.
That's right.
Strong like horse, smart like tractor.
I was trying to come up with a new name for this whole thing, and you keep getting tired of hearing the new normal, the new normal, the new normal. I'm going to call it the new abnormal.
Yeah.
It is.
I like that.
That's what it should be. It's a new abnormal. It's abnormal, man. Don't tell me it's the normal. It's not.
I saw a something the other day that the phrase 2020 is going to be the phrase that people use from now on to refer to things that are messed up.
Yeah.
Probably true.
Yeah.
No, we don't want to have a year like we had in 2020. Don't screw up like we did in 2020.
Yeah. Like, oh,
I'm just going to fill up
everything was
coffee.
going okay, and then it went all 2020.
Well, there was one I heard like that. It said, you know how people say hindsight's 2020? Well, they say now it's going to be hindsight's COVID-19.
Oh my.
Hey, Rafe.
It's not there. Did the education commissioner kind of inkle a little bit that we might start with face-to-face learning yesterday? Did I hear that?
It was really interesting, I thought. Yeah, it was really interesting because to be honest, when the guidelines came out, I felt the opposite, just based on the criteria that it seems like they're sort of establishing without saying it to go face-to-face. They're basically saying if we go face-to-face, we don't need to worry about distancing during core instructional time, and cleaning isn't as much of a, the deep cleaning thing, and they're not. And so it's like, well, if we're going to have to be in that place from a public health standpoint where distancing isn't necessary, then how good is it going to have to be in order for them to be able to turn the dial that far? But then in her call Thursday, it made me kind of come back a little bit towards maybe that's still a possibility, at least.
We got a new slide in the deck that shows we could have more than 9 kids in a classroom. You guys think we're sensing that 50% occupancy conversation would allow more than 9. Would you guys agree with that?
I don't mean to interrupt here. We should probably get going. We've got
Yeah.
about 35 people in the waiting room. I'm just going to admit them all on mute.
Yep.
And we can just get going. Is that okay?
The
Yeah,
date on
perfect.
the
I have a
date on the
question.
slide is wrong.
I have a question first.
Oh, shoot.
Karen,
Yeah, go ahead.
we do that, Arif?
Yeah.
Is there a chance you can bring in the school folks earlier to kind of set the stage on the issues that sort of they see are important on this?
Yeah, I talked to Jeff about that, so I think when his stuff comes on, we'll have the school people come on first.
In the
The
Oh,
times are
gosh.
in.
Ugh. Friday mornings. Why did we do this?
Do you have Matt Gross on the presenter list too?
I do. Yep.
Yes, she does.
Okay. Perfect.
Okay. Third time's the charm.
I don't know. I would have left it just to see how many people we could have confused.
Yeah, you should let everybody in.
Okay. Sounds good. 1 second.
Good morning, everyone. This is Arif Qureshi with ICS, and we're just going to give it a few more minutes. I know Erin is letting everybody into the room, and then we'll kick this off. So just give us a minute or two. Thank you. Erin, just let me know when you've got everybody in and we can start this up.
I disabled the waiting room, so we should be good to go whenever you're ready.
Okay, and then we have everybody, I think we had like 93 people sign up, so pretty close to that now, or?
We're at 57, so.
Okay. It's Friday morning, I can understand. Okay, let me just kick this off then. Again, Arif Qureshi with ICS. Thank you for joining. This is the second webinar we're doing, the Ready Set COVID, based on the playbook that we've developed with a pretty multidisciplinary task force that we put together. So again, thank you for joining. There's a lot to cover here, so we're going to try to go through it relatively fast. There's a number of things we want to cover today in terms of the agenda. Kind of the why behind the playbook. I think it's important that everybody on the call understand why we got involved in developing this playbook. Want to just let you know who the partners were that were involved in this, and then also the panelists that are on today to discuss this pretty complex issue regarding reopening schools, and especially in light of the fact that recently the Department of Education has come up with some guidelines, had some calls with them, and there's some good directional information in terms of where school districts need to go. But we'll talk a little bit about what we've developed is really a much more prescriptive 5-step process in terms of reopening schools, what school districts need to do, what leadership needs to do, how they need to engage the community as you move this thing forward. Because I think that's the little bit of the unknown at this point, because as we did a lot of the research up front for a long time to pull information together, we're finding out that You can plan really well, but the unknown at this point is how many parents will send their kids back, how many teachers may not come to school. So we'll talk a little bit about how you need to start communicating what the policies and procedures are as we move forward. We will end the presentation with a Q&A. So just so you know, there's a chat. Please, all the questions you have, put it in the chat. We did that yesterday, actually a few days ago with the first webinar we did. And we did get almost, I think, 30 questions. We were able to have Aaron kind of pull those together in specific topic areas. And at the end of the meeting or presentation, we're able to answer a lot of those questions. As always, our lawyers get involved, and we've got one of the lawyers on today as a panelist. They kind of force us to make sure that we put this disclaimer out there, because I think things are changing on a very regular basis. We need to make sure that this information that we're presenting is for general educational purposes. You need to really consult with your legal, medical advice or other professionals to make sure that the information we've developed, because some of it's very prescriptive, very detailed, but you will need to modify it to how your school district operates and in your consulting group that you have to make sure it's done right. We've interpreted a lot of stuff around local issues, state issues, federal issues, MD, MDH guidelines, and national resources. And then we leverage the entire task force to really dive into this and come up with a real, I think, a clear approach on how you plan to open schools. So the why behind the playbook, most of you may know us as ICS. We've done a lot of work for school districts around facilities. We just thought that at this time, with the challenges we were running into, not only with the school district, but us as an organization with COVID, and the fact that we could quickly put together a lot of experts in this area around public health, around legal, around communication, around education, that we wanted to take this on. It wasn't something that maybe is easy to do, but we felt that we were able to pull this information together into more of a comprehensive prescriptive playbook. And we'll talk more about that. What we're going to provide you today is a little high level because we only have an hour and a half. We developed almost 150-page playbook that lays out everything in detail, clearly very complex. But today what you'll see is kind of a summary of all of that, and we'll talk about how we will break it down into different pieces as we move forward. The task force, just so you know, was put together in April 2020. And we put together a variety of subject matter experts. As you'll see, we had a lot of people involved in this, from co-ops to school district leadership, to MREA, to communication experts, to University of Minnesota experts around public health and environmental health and safety, through legal. So as you can tell, it's a very cross-sectional group that was brought together to put this playbook. So task force, a lot of these people are on the call today, so you'll be able to ask questions directly through the chat through them. Matt Gross, Superintendent at Grand Rapids, Andy Almos, Superintendent at East Central Schools, Matt Schultz at Lanesboro Public Schools. Neil Carlson has been heavily involved with us on this. Neil is, I think I've known Neil for at least 20, 30 years. He's a certified industrial hygienist. He's at the Environment, Health, and Safety Group at the University of Minnesota, where they've been implementing some very key guidelines, not only around reopening the campus, but he's been doing a lot of research studies around what's the right way to reopen, how do you occupy spaces, and how do you manage the health issues that are going to come out of this once you bring people back in. Todd Rapp runs Rapp Strategies. Some of you may have worked with him in school districts. Real knowledgeable about what you need to do to communicate with your stakeholders. Seamus O'Meara is legal counsel. We also wanted to bring somebody on the legal side because everything you're going to do with procedures, protocols, a lot of different rules and regulations come into play. Again, myself with ICS, and we have a number of other ICS members with expertise around facilities, around space management. Jeff Schultz with ICS, Pat Overham, and Chris Seamer. I want to thank everybody. All these individuals put in hundreds of hours to pull this together. It was not easy, especially with the fact that we had to do a lot of these meetings on a virtual basis. They did a lot of research and pulled this together, I think, in a format that is very usable, for a lot of the school districts. So what we really developed is really a 5-step process, and there's some timelines around this I think that school districts need to be aware of. Today, right now, you should really be focusing on learning and understanding what all the issues are, understanding what all the rules and requirements and guidelines are, and then really truly understanding what you can or can't control. Because I think we can get into this entire cycle of issues that we have no control over, and that's going to take away from things that you can actually work on. Well, also, planning, scheduling your classes and the processes around that is very, very important. And I know that a lot of school districts are already working on that as we move forward. Starting July 1st, I think it's really important to start preparing your people for change and your community for change that's going to come. I heard something on the radio today that was pretty interesting. We keep calling this the new normal, and I think people are getting tired of hearing the new normal. I think on WCCO, they talked about how this is probably the new abnormal. I think we have to understand and manage that as we go forward, but you have to be prepared for it. And then how do you implement all these processes and procedures going forward? Communication needs to be ongoing, should have already started, should continue throughout this process, and will continue even when the students come back, because you are going to have certain challenges and you have to be ready for those. What we're going to talk about today, though, is really around the first 2 components. We can't cover all of those. Our intent is to cover the first 2 pieces, and then starting in mid-July, we're going to have breakout webinar sessions that hit each topic area so that you can send different people from your school district. So if it's a facility issue and what you need to do to modify your facilities and retool them, we'll have a facility webinar. If you want certain people that are involved in HR, that are involved in procedures and protocols, we'll have a separate kind of a webinar around that. So the intent is to give you a full overview today so you truly understand what all those steps are, what you need to be doing, and then we'll dig in deeper into those additional webinars. Let's talk about step 1. This component of what we're going to talk about today, we'll discuss some challenges that you all are facing, learn what you can or can't control. Neil will get into a little bit more detail around the public health concerns and practices. I think it's extremely important for school district leadership to understand and separate the fact from fiction, because I think there'll be a lot of anxiety in the population, especially when you will have, even though in certain counties in the state of Minnesota, we don't have a lot of transmission, but even if you have a few of those, how you handle that is going to be extremely important. So I think understanding where the risk lies, where the transmission happens, and I think there's a lot of misinformation out there. So hopefully Neil will clarify that. You also need to look at contact tracing. A lot of situations you are going to run into issues where either an individual is positive or they have symptoms, or, which is going to be the biggest challenge you all will face, is you're also going to hit the flu season. So how do you differentiate between the flu and COVID and other types of diseases? It's going to be important. We've also developed a very detailed exposure decision tree. It is a process. We looked at the CDC guidelines, the MDH guidelines. We had Neil Carlson from the University of Minnesota review it. But again, you will need to customize that. But it really provides a very clear direction on what you do in different situations when you will run into those situations, either with students or with your staff. And then how do you manage those hotspots that happen in your buildings? And what's your legal responsibility going forward? So with that, let me pass it on to some of the educators and Jeff to really talk about some of the challenges and some of the other areas they're working on.
Well, thanks, Arif. I think this is mine to get going on here. Good morning, everyone. My name's Andy Olmos. I'm the superintendent of schools at East Central Public Schools. I know we have other superintendents that participated as well. So Matt Gross and Matt Schultz, jump in at any time as we get this going. But yes, we have a significant challenge in front of us as school leaders. You see those challenges, you know, this isn't even a comprehensive list of the challenges, but the legal and health, decision-making processes, educational, environmental, facilities, and communication. I mean, it goes on. And as a school leader, I think we quickly come up with more questions than we do answers. And I think the task here today is to show kind of a roadmap to how to put those decisions in buckets so that we can break those down for our people, make them into smaller tasks so it's not quite so overwhelming. I think one of the big things we have to keep in mind is that we have to be prepared for change. You know, I see this not maybe so much as a challenge as it is an opportunity. This is our chance to reform public education, and maybe we've needed that for quite some time. But we're going to design 3 models for every school system in the state of Minnesota, and that's challenging and exciting at the same time. I think one of the big things we have to think about is focus on not losing our kids. You know, where are the kids? If there's kids that are uncomfortable coming to school, can we engage with them and get them into one of the models to keep them enrolled in our school district? You know, I'm significantly worried about staff health concerns, and do we have all our staff ready to come back in the fall? Those are major things that we have to think through this summer in the next few months. Our union contracts. The collective bargaining agreements we have with our unions are designed with an old model in mind, or the traditional model in mind. There's going to be significant challenges with those contracts as we look ahead and design these other systems. I was talking to my principals yesterday about how every illness that comes up this next year is going to be treated like COVID-19. So do we have a COVID response plan if and when we have a case in our school district? That's a significant challenge, even beyond designing models to operate school. So change is going to be hard. As we know as school leaders, no matter what we change in our school system, some people embrace it and some people you know, are against it. So we have to think that through and be prepared for this major change. Matt, is there anything to add there?
I like what you had to say. This is Matt Gross about buckets. And one of the things that I've noticed in working through some of the conversations with our staff is that there are different pieces of this work that speak to different people and that different people get concerned about. And as a result, when you get in a room, people want to go in a million different directions. And without having a process in place or a scaffold, essentially, and we know that about learning, but a scaffold essentially to create a process and some structure to the discussion, you end up wasting a lot of time. And so I think the ideas that are being talked about in terms of process are really important. I've also observed that people have a different level of anxiety about things. And so as leaders, our role is to communicate stability, or to present stability, and that we're going to figure this out as best we can and work through it together. And I really like what Andy had to say about the opportunity presented here for educational change that's been necessary. Many of the things that came up in our discussions yesterday with my teams are things that we've been needing to do for a long time, whether it has to do with how we think about curriculum, how we think about learning, how we think about community and parent engagement. You know, Grand Rapids is a district of 4,000 students, and we had conversations yesterday about making personal phone calls to families. That's not something that districts that are that size typically do, but that would really change how our parents feel about our school district if parents were getting personal phone calls and not robo phone calls. And we, you know, when you have a lot of children in your school district, you also have a lot of staff, and so it's just thinking about those things differently.
So if we look at the things that are in our control and out of our control, I mean, like any initiative or anything we roll out at school, many of these factors come to play, but this one is probably bigger than many that we faced as school leaders. But if you look at, you know, those external factors, local and government, we see special sessions popping up with the legislature. What does that mean for us? The newspaper, political parties. We have a presidential election coming up. What's that response going to be following the election? Our neighboring school districts. Normally when we plan initiatives or things of this caliber, we look to our neighbors to say, what are you doing? And we try to beg, borrow, and steal, and, you know, take what works for us. But I think in this case, it's different. I think each school is going to have to design what works for their school district and their constituents. Chamber and other community groups. those business partnerships. You know, as an example, you know, our school district struggles with broadband access, and we're engaging our businesses to see if we can put hotspots in their parking lots and different things to help out our families. Those are some of those external factors we're going to have to really look at. Some of the internal factors, parent anxiety. I'm certain in your school districts too, there's some parents with a major amount of anxiety on both sides of the issue. Just yesterday, I had a conversation with a parent quite upset that there's even a different option except coming back to school. They want their kids back at school. So there's parent anxiety on both sides of the issue. Your school boards, you know, the school boards are the ones that represent the community. They're the ones going to get the questions on the sidewalk in the businesses. Are we prepared to talk about why we're doing what we're doing and give them those sound bites and that information that they can talk through with their community members? The internal factors with your high-risk staff, as I mentioned before, and students, do we have a plan for them? Medical privacy, we need to talk about pre-existing conditions, high-risk staff. Do we have policies in place to control and to talk through some of those things? And I think Seamus will get into that here in a minute. Mental health pressures and poverty. There's a lot to this issue, and there's things we can control and things we can't control. But I think as school leaders, we really have to focus on what is in our control and what is hanging out there that we really should kind of ignore potentially, but just be aware of. I think just a few more comments. I think the tolerance level of people with this COVID-19 is evolving, right? As I mentioned, some parents are saying get their kids back to school, and some are saying I'm not going to send them. So there's a huge varying tolerance level with this COVID-19 issue. I think any anxiety producing situation calls for increased communication. So have we thought through our communication plan? Do people know when we're going to communicate what our plans will be? And when that anxiety goes up, I think we as school leaders have to stop and really make sure we are communicating and telling people what we're doing. And there'll be more coming on that down the road. Any more to add there, Matt and Matt?
No, that was good.
Okay. So I'm certain every school leader around the state has the 100-page document from MDE on their desk right now. And we're trying to sort through what does every little piece of this mean. But the long and the short of it is we have 3 school models that we have to design. And if you're like me, I've had people in my district say, well, why don't you just wait until they tell you what model you're going to use? But I think we have to think more globally about that. And we have to design 3 models that potentially we can switch between. Whether it's even just this school year or down the road. You know, this 100% in-person learning, that is an option I think that we're going to get back to, but I don't believe that it will look the same as it's ever looked. I think we have to communicate to our people that that's the option that we really want for our children. That should be first and foremost on most communications coming from a school district. We want our kids back at school. We think that's the best educational model that's out there. But we have to be prepared to flip the switch. I just, before this meeting, had a conversation with our technology folks about, can we create a spot on our website so everybody knows where to go and when these models are designed. So if we have to flip that switch, everybody can see what our plan is for the 3 different models. Good and bad, we had we had the spring where we had a chance to pilot distance learning. Every school district, I'm sure, has learned a great deal through that process, but are we prepared to tweak what worked or tweak what didn't work and to continue to use what worked when we design these things? So I think, I think we have to look at this planning process as this big switch or this dial that could potentially change on us. We may be able to flip that switch ourselves and talk about that, or we may have the governor tell us where he's going to set that switch for us. We just inserted an example here, and for me, this example comes down to communication. Again, just talking through the decision-making process of a snow day, right? On a regular snow day, I'm up early talking to our area superintendents, maybe driving the roads, looking around, watching the weather, hearing from different people about what might happen with school, and we compare and we talk through that situation. But I think this will run in parallel with this idea of the dial. Will the dial change on these different models, and are we prepared to make those decisions? When we make those decisions, we look to our neighbors for help and support. But I really believe that we are going to have to just look internally and design this with what works for us. But the snow day example, I believe, you know, may hang out there for some time as well. You know, in our school district, we're talking about snow days may be a thing of the past, given these 3 models. Even looking way ahead, we may crank that dial over to distance learning or hybrid, depending on how snow days come to us. So again, there's an opportunity in front of us here, you know, to get this designed for what works best for our school system.
Andy, if I can just jump in there quickly, I think one of the things that's interesting about the guidance that we've been given recently and difference between what happened this spring and now is, you know, last spring, the conditions were very different than they'll be this fall. You know, we were instructed exactly what the model is going to be that we were required to use. And as districts, that gave us some cover in a sense to be able to say, well, you know, we don't like it either, but we were being told to do distance learning. And so it's going to feel very different in the fall when we have options potentially, and that's based on what we've been told by the educational leaders, that there may be the opportunity for local decision making. Those decisions are going to feel different to the community, because there'll be decisions that the community will know that we are making, or we are making in conjunction with others. We won't be able to just say, well, the governor made us do it. And so we're going to have, I think, really, really thoughtful conversations about what are those metrics, what are those criteria, who are we working with, and how do we communicate the basis for those decisions, knowing, just like the snow day example, that we're not going to please everybody.
So I think just to give a quick overview, we'll run through this pretty fast, but I think most of you are aware of what the public health concerns are. So maybe Neil, if you can just give us a quick overview of where things are and maybe any updates.
Yeah, the basic premise that we're looking at, and this primarily is focused on some faculty and some of your staff, is that the older that your staff is and the more pre-existing conditions that your staff has, the higher risk they are of acquiring the COVID infection and having it turn out to be a serious outcome. So if, for instance, I have some relatives that are above 80, I mean, they're not going to go outside. They're really going to have to be restricted. And I think one of the things we had discussions in the other part is, you know, what do we do with the bus drivers? We need to really take care of them, because a lot of them are, at least are older, and we want to make sure that we're taking care of them and how we manage that. And this disease continues to evolve. The CDC just pulled out some more symptoms, and they aren't terribly helpful as far as diagnosing, because they say runny nose and congestion. Well, that could be allergies. It could be something else. So I think, you know, involving your nursing staff to kind of sort through this and figure out whether it's COVID or not is going to be really problematic, especially as we roll into the flu season. So I see this as a big challenge and something we're going to have to lean into rather than run away from. The transmission on it, everyone's been getting some pretty good information that's been coming out there, and the primary method of transmission is either through coughing and sneezing, but I think more of the focus has now been on just specifically talking or singing or doing any activities where your mouth isn't covered and you're interacting with other people. Social distancing or spatial distancing has been touted as a way of minimizing exposure, and we shouldn't use that in isolation. We need to think about that and probably some other control measures as well, because for short-term interaction, 6 feet is a pretty good way of minimizing the chance for 2 people to contract it. If they're standing there for an hour in the discussion, then we have the situation where the big droplets have kind of gone away, but then we have a lot of smaller droplets in the air, and then we can have some airborne transmission, and people will inhale that and then become infected. And you've seen that with some research on some people who've been in choirs singing at restaurants. So those are some things to really be concerned about. So there's a lot of different ways that we can control it. Distance is one, wearing masks is another, thinking about face shields, thinking about ventilation. So there's a lot of methods that we need to control it, and we shouldn't be hung up on one. We should try to use as many methods as possible to minimize the chance where we transmit infection. And we have some notes on the UVC light. The incubation period is fairly straightforward. The symptom range between 2 to 14 days after exposure as far as when you will elicit symptoms, and you can transmit the infection when you're asymptomatic. For UVC light, we had quite a bit of discussion on that last talk, and the main piece of concern on it is that there are several different types of UVC light. The one that I recommend for use would be the UVC that's at 254 nanometers. It's also known as UVGI. There are other, if you go online, there are also other UVC decontamination lights, but they produce ozone, and they're around 180 nanometers. We do not want that. Ozone is a very strong respiratory irritant and can cause some significant health problems. So we do not want that used, especially in occupied areas. The primarily health concern with respect to UVC would be direct exposure by looking directly at the light, or having it directly on your skin, although that's less of a problem. When you're using UVC for decontamination, it's appropriate to clean the surface first with another method, and then you can use UVC as a backup to fully disinfect the area. If you use UVC alone, you can have protein or other material that are mixed in with it, and it will make it less effective. So the plus side is, at least with respect to transmission of disease, the surface contact, that type of problems appears to be much less of a problem with respect to transmission than aerosol, direct aerosol contact between 2 individuals.
So this is just one of the Sarif back on here. Just what we ended up developing based on CDC guidelines and based on Department of Health guidelines was, and we'll have these for what it's different types of exposure, but it's really a decision tree, because you're going to have these situations on an ongoing basis. You may have a student exposure scenarios. What does that really mean? How do you manage that? What's the next step? What's the protocol around it, right? So this is just one of the kind of decision trees we pulled together. We are working on finalizing the playbook so that we can get that out in mid-July. That'll have a lot of these protocols laid out, so you can again, caution people, because the information and data continuously changes, that you can use these, but you will need to modify and update it based on your individual need. So for example, right, this is one scenario we've laid out. So if a student's household member has symptoms, it's important. How would you even know? You need to have a protocol about that. But let's say they have those symptoms. What the recommendation is that the student stays home from school for 7 days to monitor the symptoms, and they don't have any symptoms, they can come back. What happens if a student's household member is tested positive? Student gets tested, stays home until results are available. If the results are negative, they can come back. If the results are positive, of that member, they really have to stay home. So again, the challenge here is you need to have these processes laid out, but you also need to communicate that to your stakeholders so that they are aware that here's your procedures, and you will need to know this information as you move forward. Just a quick note though on some of the things that Neil talked about. I just want you guys to know that the changes and information that's changing here is important. So one thing we know now is that surface transmission is pretty limited. So it's there. You can get infected due to these droplets being on a surface, you touching it, and then touching some of your mucous membranes. There's a potential for exposure, but very minimal. The main exposure is through the aerosolization. That's what we're seeing right now. And we're also seeing that the young people are getting more and more infected. So in the past, you know that the young were protected, but the 20 to 40-year-old people are the ones that we're seeing the significant increase in infection rate. So one of the issues we're looking at is, the other piece is the ventilation system itself is not a route of transmission. So in other words, let's say I'm infected, I cough and sneeze in my room. Is there a potential that this stuff will go into the return air, go through your ventilation system and back in? That doesn't really happen. The issue really is if you can somehow significantly increase the amount of outdoor air, you're going to limit a lot of the transmission. So just wanted to summarize some of those things. And then these protocols, these decision trees, we'll make sure we have those available for you so you can use them, modify them, and adopt them in your policies. The other issue you are going to run into, it's almost a guarantee, is managing hotspots, right? You will have situations where either you will be notified that somebody in your building is positive or a family member is positive. How do you isolate them? How do you, in a situation, if somebody is sick, is having symptoms, and the nurse tells you that they have symptoms, how do you move them out of that space? How do you clean and disinfect? And then you need to also then notify health officials and close contact. So that whole contact tracing is, there's no way around it. You will have to make sure that you have a protocol around this. The other thing I just want to mention, and I think Matt and Andy had talked about it, that we're hoping, we don't know if this is going to happen, that districts will have the opportunity to make the decision around what spectrum, whether they're going to go to 100%, you know, in-class learning, or some hybrid, or potentially distance learning. And what we laid out here is just when you look at the state of Minnesota and you look at county transmission rates, you start noticing some significant variability on that transmission. So we think it's important that you need to have this data available so that you're able to make decisions based on what's happening in your area, and you're ready and prepared that if the situation isn't bad, you probably can turn the dial one way. If it's really bad, it goes the other way. The problem we are seeing, though, just so you're aware, one of the things that we track, we don't have this data by county, but it's called RT. RT is a transmission rate. So the transmission rate, for example, we have it by state. If the transmission rate is 1 or greater, your transmission rate and infection rate is increasing significantly. You need to track that to make sure that if that happens, we need to go start shutting the economy down again. Minnesota has been doing really well. It has been operating at about 0.84, significantly less than 1. However, the last few days, we've been tracking that. That's gone up to almost 0.92. Again, below 1, but we're seeing that because as the economy opens up, there's going to be more transmission. So just want you to be aware that there is data out there. We are trying to come up with a way to calculate the RT rate within each county. It's been real tough. We were able to get the algorithm that looks at it on a state-by-state basis. It may not be as easy to figure this out, and they've just modified actually the algorithm again so that you get more accurate picture. The mention here is really about the fact that we're hoping that by county, by your school district, if you have that data, you can make some good decisions around why you may want to go to 100% in-class learning, because you don't have that transmission rate issue. However, if it increases, you need to dial that back down. We think it needs to be done county by county. I just want to have Seamus maybe, and I know we got a lot to cover here, Seamus, so if you could just give us an overview of some of the key areas of legal and policy and protocol issues that districts need to be aware of.
Sure. Just briefly, whether you're attending on behalf of a private or public school, your obligation is really the same. You have to act with ordinary care. It's a standard of reasonableness. You have to act with reasonable care to prevent foreseeable injury to students, to staff, to others under the circumstances. So what's our circumstance? It's a worldwide pandemic. So not acting or acting minimally is going to be very suspect in terms of discharging your obligation of reasonable care. You can also become responsible or liable, legally liable under contracts or under specific statutes. And there are a lot of them in play, from employment statutes to OSHA to student privacy protections, you name it, it's involved in COVID-19. So you have to really understand, these issues. And I think Matt said it earlier, we now are in a position where we know some things going into the summer here that we didn't know in the spring. And so our obligation to, vet that information and make informed decisions is paramount. So as you are developing and implementing an appropriate reentry protocol, what are you doing about PPE, social or physical distancing, remote distance learning, design reconfiguration? Are you attending webinars like this? Are you attending the breakouts? Are you looking at the CDC reopening guidance, the Minnesota School Boards Association, National School Boards information? Are you collaborating with local assets, city, county, township, mutual aid, co-ops, local health, police, fire, your insurers, and loss prevention and risk managers? They all have great information to share, as well as your design professionals and program managers. And I should mention, that you're obligated, whether as a private or public school, to have a emergency management plan. And so how are you implementing COVID-19 as part of your district-wide school safety plan, your building level emergency response plans? What about your incident command structure? What about a continuity of operations plan for sustaining or redelivering and reconstituting essential services if you do have an exposure? All these things need to be looked at now and employed now, and they may need to be modified or amended based upon the circumstances, including whether you have an exposure in your school.
We'll talk a little bit about kind of the step 2 plan. So Jeff, if you can just give a quick overview about some of the key things that districts need to do, or the educators.
Yeah, one of the key components is to start putting your committees together. And again, MDE guidelines are you need to have a COVID director within your school district. We're going to have to identify some of these high-risk staff and students. Obviously, put in place some of these policies and procedures that Seamus talked about. And I know Seamus is working with MSBA on some of that work as well. Establishing some timelines as we come back to school. Obviously, ordering supplies and those sorts of things, and your communication planning. And we're going to dive into this a little more detail here. And I'm going to turn over to Andy and Matt just to talk a little bit about the various committees that they've been setting up in their districts. And I think one of the key components is to look holistically. It isn't just principals trying to figure this out. We need to bring in our bus drivers and transportation folks. We need to bring in our nurse folks. We got to be talking about athletics. And we do need to be bringing our union representatives to talk through different contracts and so forth. Matt, Andy, comments?
Again, I think this speaks to the need to have a process to organize these conversations around, because if you assembled if you assemble this group, each person from each one of these groups in a room and said, we're going to talk about COVID, the conversation is going to go in a million different directions. And so having a process to work through and talk through, I think, is really important.
Yeah, and in our district, we talked about the influencers, right? Get the people at the table who can influence this work. I see my job as the COVID director and the superintendent as I want to break these steps down, as I mentioned earlier. Break down the pieces and set them with the right people, so that this task isn't so overwhelming. So in our district, we've started with our administrative team, and we've brought in people to that team with a daily meeting depending on the issue that we're talking about. So we're already down that path, and I just would encourage school leaders to look ahead at a timeline and set some benchmarks for when this work gets done, and put that timeline out to those committees so that we're ready for fall.
Yeah, we're used to being taking summers off and having some downtime in education. I think this summer is going to be if you haven't started to set these committees and the dates, I think you really need to begin now.
I think that's a good point, Jeff, because I've had to have the conversation in the districts that I'm in with people that are, like you said, not used to working in the summer, and depending on where you are and the kind of the mentality of people, you have to work through some of those tough conversations. That this is the time where leaders, we need to step up, and that's going to require us to do things that we maybe don't like to do or haven't typically had to do. But the time, the situation calls for extraordinary action.
So, and maybe we'll run through this, Neil. Just one of the things we'd asked Neil at the U of M to do was start taking a look at exactly what are some of the key guidelines and some of the things that you need to pull together. Just so you know, one of the things we have put together is a kind of glossary list of all the key resources. It's at the end of this presentation that identifies what those resources are. You can click on it, you can get the actual information rather than having to go back and forth with a lot of this information. So we kind of put this information together much easier for you to use. So one of the things we asked Neil to do is start looking at some of these areas, but then also start looking at the kind of education that's delivered, and coming at from more of a public health person's perspective is how do you start risk rating or do relative risk ratings on the different kind of activities that are going on in the school. This really hasn't been done except for this group pulling it together, because we said, we need to have real data to say what are the different ways education can be delivered, but what are the things that have lower risk? What are the ones that are higher risk? So you may have seen some of those across the US where it talks about, bars are a high risk and playing tennis is a low risk, right? But how do you do that for education and the kind of education that's delivered? So Neil, if you can run through some of the things here and also that risk rating.
Sure. I think what all districts are going to have to sort out is how are you going to screen your staff and your students prior to coming in. And there's a lot of different models to think about. There's one that's self-reporting, but if you do self-reporting, speaking from personal experience, it's very difficult to get a thermometer. So are you going to screen people coming in or not, or how are you going to do that? There's ways of, there's some devices that'll scan people as they come in, and you can use that, or you can have them temperature screened. So you need to think about how you're going to do that. Do people need to go through symptom lists? Are you going to have a statement or a contract that people sign that says, I'm going to review my symptoms, and if I have these, I'm not showing up? Because if we have symptomatic people coming into school, you can have a big outbreak very quickly. So this is really important. I think health screening is a piece that you can use and use it well to minimize it. You just have to figure out logistically how it's going to work. Symptoms list, that keeps changing. So they just added 3 more symptoms on there, and using a symptom self-checker and try to sort out whether it looks like COVID or not. If you want to get tested for COVID, they've got some online that you can do those self-tests, and that will help you to determine whether you should be checked or not. Then someone's sick at school, we've had to have that at the U, and we've done some cleaning. The cleaning is not as onerous as it used to be. We've got some relatively simple things that you can do. You leave the area for a few hours, clean it up, and you can be back into service. Before, they were talking about a long time, and if you want to be super safe, you can leave the area for 7 days, but most times people want to get back into the space quicker, so you have to think about that cleaning guidance. And then MDH has some good guidance for when people are sick at school. And then we've developed some guidance on cloth masks. I think this is an area for ripe for some improvement. I've got some graduate students that are looking at specific materials that appear to be better. And we're going to have some more information available on that probably in a couple weeks. But I think focusing on if we can get cloth masks or better, that's good. And then who do we decide to give the better mask to? And how do we choose these masks so that we still aren't taking away the N95 from healthcare workers? And thinking creatively around that's really important. Next one. So Arif asked me to take a look at different activities that students typically engage with and what the risk level would be. So if you want to have band and you want to have band in a traditional setting, I think you're putting a lot of people at risk. They're in tight quarters. They're exhaling a lot of energy. Same with choir, no masks. And we've got some data that, from that church choir out in Washington where, we had some people die and a lot of people got sick just from a brief 2-hour session. If you have choir every day, I think you're asking for trouble. So then I gave some possible solutions. You can do remote band, remote choir, and you essentially Zoom in. It's very difficult, but some teachers are able to do it. Or consider moving it outside, spatially distant. Give that a try. Indoor gym is really problematic. And the way of solving that would, okay, if we want to have the activity, then we move it outside and we spatially distance and we have non-contact sort of exercise. Cafeteria is a problem primarily because people are eating and they can't wear a mask and they're in close proximity to each other. So we need to spatially distance and we need to have lunchtime be really short. And if you can eat outside, that would be a great way to handle it too. Theater class, speech, indoor sports, all of these things where there's activities inside and you aren't wearing a mask are really high risk for transmission. And then we look at full classroom, no masks. Again, that would be problematic. So we're looking at, okay, smaller, 50% occupancy, maybe less, spatially distanced, and people wearing masks or face shields. And then traveling to classes, somewhat less problematic, but you have so many billiard balls or people bouncing back and forth in between the traditional method that you've essentially got a large cloud in the hallway where you can potentially transmit disease. And then live indoor concerts or indoor performances are also problematic. Next. So again, moving things outside, I probably even move that based on what we've been seeing from the protest, probably down to risk level 2 rather than 3 if you do things outside and you're far apart. Again, outside would be another one that you could do with choir. Outdoor gym, again, I'd probably put that down to a 2. Bag lunch in class would probably be better than everybody interacting with each other in the cafeteria. Again, outdoor theater. And if you can do anything outside, it's a lot better than doing it inside. And then reducing the classroom size is also another way of minimizing exposure, getting good ventilation in the classroom, getting spatial distance. Next. Then here's a scenario. We've got some buildings on our campus where we have absolutely no outside air, radiant heat, minimal airflow at all. And we put people in there. If we put people in there, there's no airflow at all, no dilution. That's really, you have to have extremely low density because if you have high density, your probability of transmission goes way up. Room with recirculating fan coils. This is like a lot of our dorms. And no operable windows. That would be another case where you'd have some chance of it. And if you have good air filtration, adequate amounts of outside air, then you're going to dilute the viral particles in the air. Very large rooms are also helpful because you can get a good spatial distance. I think one thing that we need to be careful about is if we decide to use room fans to direct the flow of air within a space, then you can create a situation where there's one person that may be a shedder or of the viral particles, and then it spreads throughout other people. We want general dilution, but we don't want directional airflow. Next.
So this I know we'll probably skip this a little bit because I think this is something I think Seamus you talked about before, but you'll have this available I think on the website. I don't know if you have any comments on the policies and procedures here, Seamus.
Well, just briefly, again, whether you're private or public school, you need to act from a leadership standpoint with reasonable care in these circumstances where we're dealing with a worldwide pandemic and a lot of specificity with regard to emergency orders by the governor here in Minnesota. So one of the things I would look at is whether you want an emergency resolution to assist the implementation of your COVID-19 policies. I think that crosses both to the public and private school side. Certainly, public school districts have, compliance issues on open meeting and competitive bidding and whatnot that private schools don't always have. But you're sharing the same types of concerns about remote board and committee meetings, school building closures, distance learning, what alternatives you're going to have in place, what your facilities plan is going to look like, staffing and PTO policies. Andy mentioned, that we're just touching on a few. There's just a myriad of things out there, and you need to provide some leadership and make informed decisions based upon sound information and develop the policies and procedures that you are going to have going forward, and they have to be flexible and communicated appropriately.
Thanks. I think these are some of the rules and regulations, correct, Seamus, around that they will be, whether it's FERPA or HIPAA, privacy rules, Minnesota Government Data Practices, National Resources. So again, I think the comment on this slide was just so that people understand that there is going to be some significant issues around student records and privacy exceptions, and the challenges I think you're going to face is you need to have these policies in place, because you will have a situation where some student is going to be infected or have symptoms. Can you notify the other parents? Can you not? Can you notify them without the person's name? All those issues will come into play, and I think you need to, what we're recommending is make sure you understand what these key rules and regulations are, get a hold of your legal counsel, and make sure you've got the policies laid out.
Right, and it's not just legal counsel. I mean, there's the school leaders know this. I mean, your HR department, your medical compliance personnel. It starts with the student and parent handbook and your infectious disease policy, and having buy-in from your school community about those procedures before they even set foot back on campus, so they understand the truly important issues that we're dealing with COVID-19 and this worldwide pandemic, and so that all gets sorted out before they walk in, and then you have to have a medical protocol to implement when there is an exposure or threat of an exposure, and you have to take a look at on the public side, the federal Family Emergency Family Educational Act, FERPA, and also from both public and private standpoints, the Government Data Practices Act, to understand whether and to what extent you can provide any student privacy data, health data, and to whom, right? So those are really important issues.
Thanks.
One of the things that, we talked before is the importance of your timelines and getting your meetings, your committee meetings started. And I guess just one thing to be thinking about, most school districts, you might have 2 board meetings set up from now to the start of school, one in July, one in August. I think you really need to start thinking about adding another a school board meeting in August, so you have time to adopt and approve some of those types of policies, procedures that Seamus is referring to. Again, he'll have more specifics around that as we get into the mid-July webinars that we'll be providing. But I think school districts need to be preparing for that. Next. The other thing, if you heard Seamus talk about the standards of reasonableness, boy, school districts, if you're not already ordering some of these very simple things such as sanitizing and disinfectants and those sorts of things now, your community and parents are not going to be, they're not going to accept that you have not taken the time to order that stuff. And if we're out and we didn't have enough because we put our order in August, people are going to be really frustrated and upset with the school district, and rightfully so. So one of the things you really need to do is start looking to order that now. The service cooperatives and their cooperative purchasing, they have, and we'll provide that link to you, a link directly to the ability to order these through your service clubs. Next. The CDC has some great guidelines for schools. They have some great posters for schools. Boy, here's one thing you could do now and start printing these off, having them put in and throughout your school. Get this out of the way, get her done now. One item that can be done immediately. And we've got connections and links to where you can find that information. Next.
Okay,
Yep, go ahead, Todd.
I'm going to step in. It's Todd Rapp of Rapp Strategies, and thank you all for joining us today. You know, you can have the best plan for getting back to school and protecting the health of your students and staff, but if it's not understood by the community, it's probably not going to be a very effective plan. It's critical that you're beginning your communications planning now. And I'm going to tell you, as a parent and as a consultant, I receive dozens of emails literally every day about school safety and back to school plans. The one I always read is the one from our local superintendent, because I know I'm going to get the information that matters most. Now, there's a few bullets here with tips for you, just thinking about at a high level how you put together an effective communications plan. One thing I want to point out is that first bullet. It's an ethical responsibility for any school district to communicate often, consistently, and truthfully. And I'll tell you right now, your communication probably about your back to school plan needs to start the week after 4th of July, and it's going to continue until the pandemic is over. Now, I've done a lot of work for nursing homes and hospitals over the last 3 months, and I'll tell you that one of the things that we've agreed on, my clients and I, is that we're not going to let the state do the communicating for us. The state is here to communicate primarily to school districts and administrators and school boards. It's your job to communicate locally. And it's critical that you're reaching out to your community, because that's how you're going to build trust in the leadership, but it's also how you're going to overcome the fear and anxiety that comes on. No one's been through this before in our communities. And so they're going to need information that demonstrates that the school has a plan. The plan's not going to be perfect. We might as well agree to that right now. What they want to see is that your plan is thoughtful and that you're working on how to improve the plan as time goes on during the school year. At the bottom here, I've showed you just a few tips as to what should be included in all of your communication. But one critical point is to allow people to provide feedback, and then you need to respond. Superintendents who I've worked with have heard from me on this before. Put in a 24-hour rule so that you can make sure you're responding to people quickly. You should also engage your local health leaders. Bring together a group of local health professionals. Their expertise is going to improve your work, and frankly, their credibility is going to improve the impact of your communications. But make sure when you do that, you identify procedures for who is in charge of sharing that information and what your proper communications tree is. Discipline is critical at times like this, both around messaging and who your speakers are. Now, I agree with the comment we heard earlier. This isn't just about a new normal, brand new expectations. You're never going to go back to how things were in 2019. And I will predict that pandemics and infection control will be part of your life for the entire next generation of students. You will begin to use public health messages in the same way that you use messaging around communication, technology, and transportation. And my advice on all this is that think of yourself as the best source of information, because if you don't meet the expectations of your residents, they're going to go to other people who aren't going to have complete information about what's going on in the district. The final piece of advice I'd give for now, and I'm happy to talk with any of you if you want to reach out to me via email, but do a self-assessment as to how well your communication went during the last 4 months of the school year. And then think about how you can improve your communication going forward based on that assessment. Be honest with yourself. some of the tools you're going to need are online communication is expanding, especially to parents and staff. You should be thinking about how you're using video chats with community leaders and other leaders within the school district. If you do a regular telephone survey, you should think about adding questions about the COVID response. If you don't do a regular telephone survey, think about using online surveys. And some of the superintendents from the last presentation we did reached out to me and asked me if I had a sample. I do. If you drop me your email, I'd be happy to send you the sample of what a COVID-19 survey would look like.
So as we mentioned before, as we look at the multiple processes that you have to follow and the timelines around that, we just want to give you a quick sneak peek on the webinars that will be hosted coming up in mid-July. That's where we provide the entire playbook and we break it down into the big pieces and go much deeper into exactly what you need to do in a prescriptive manner, what the checklist you need to have, what are the things you need to do in terms of ensuring that there's examples to some of this. The other thing I just want to mention is we've asked, and we got a lot of responses at the last one, we want to take at least a few school districts, a few of the buildings, and literally help them lay this entire plan out from start to end as a case study, because I think that's how you're going to be able to get other school districts to use that information rather than a little bit more theory that we're presenting at this point. So if anybody's interested, there'll be information after. We can only take a few. We just don't have the resources to handle this across the board. So what we're looking at is a few school districts where we can come in with all the experts and help develop that entire COVID response plan, the policies and procedures, the example communication, the various checklists, the decision trees that need to be customized for your school district, and actually develop that for a specific customer, and then use that as a case study to get it out to all the school districts where somebody's actually followed this entire process and procedure and implemented that. So we're going to talk a little bit about the next steps. And I think, Jeff, this is really important in terms of determining your spatial needs going forward.
Yeah, and you can move to a next slide. One of the keys, and I think it's important for people to recognize, if you look at the MDE guidelines for summer school, their guidelines were 9 students per classroom. And now their guidelines have changed, and it's a subtle change, but it's 50% capacity, 50% capacity of your facility. And I think some more definition needs to occur around that. But when you look at 50% capacity, it's different than 9 students. And you can see from the graphic that we have on the screen, there's ways to align your classroom to meet the guidelines of MDE. It's everything different than what we've been doing with learning with face-to-face, collaborative learning, back to the students all facing the front and making sure your desks are each student is 6 feet away from each other. You have wide corridors and areas away from the teacher. So there's different ways to do that. And if you go to the next slide, one of the things we did with Deer River Schools, we took a look at their elementary school and what spaces could be used for classrooms. In other words, the gymnasium could be broken down into some classrooms. The media center could be broken down into classrooms. And so you'll see the green squares are typical classrooms. The purple ones are those areas that could potentially become classrooms in order to space students out throughout the school. Next. We also worked with MREA and Fred Nolan, and if for those that may have attended his webinars earlier in the week, you'll see a tool that was shared. And I would encourage folks to go to MREA and look at the information that they have on their website. They've got some great guidelines, including this tool. And this tool was set up with the intent of 9 students per classroom. And so this tool might need to be updated based on clarifications from MDE. Let's go to the next slide. But the tool that we assisted Fred Nolan in putting together allows you to put some different variables into into his kind of tool and spreadsheet, how many students do you expect to come back? How many staff members do you expect to come back? How many classrooms do you have today in that school? How many classrooms could you have if you added some additional spaces? And then it looks at, do you have enough space in that school to house all your students, right? So in a hybrid model or in a back to school model, I think these are some of the important research things that you can be doing over the next month or so to start looking at various models for opening school. Next.
So I think the next piece I think we want to talk a little bit about is around the physical space and reorganization and the infrastructure modification. So if Pat Overham, if you're on, if you could just quickly run through this. Thank you.
Yeah, so in the light of time here, we just wanted to spend a few minutes taking a look at some of the reorganization and infrastructure considerations with you. Obviously, as Arif mentioned at the beginning of the presentation, we've got a ton of information compiled on these subjects, and ultimately the intent is to go into greater detail with those follow-up focus sections, but we wanted to at least touch on some things high level for you today to get you thinking about things. I guess to start off, clearly as we look at the fall and getting back to school, we're really going to have to rethink how our buildings are being operated and utilized on a day-to-day basis, right? And in order to adhere to all the public health guidance and everything else going on, a lot of changes are going to have to take place. As has been mentioned before, it's really important that you take any of these considerations or recommendations and evaluate it based on the merits and appropriateness for your situation. Obviously, a ton of different school buildings out there and facilities and systems and so on, and any of these recommendations or considerations are going to have impacts on staffing, impacts on costs, and so it's going to be extremely important to carefully evaluate them and look at them individually to see if they fit for your unique circumstances. When it comes to indoor spaces and shared spaces, this is where we'll want to consider things like Jeff mentioned of reconfiguring classroom furniture and space layouts. As was mentioned earlier, taking a look at repurposing some of the large spaces like gyms or cafeterias or commons areas to see if those can be utilized for instructional purposes to enable kids to spread out. Looking at installing physical barricades or partitions, coming up with ways to install floor markings like we've all seen all over the place in stores and restaurants and so on, possibly looking at removing certain furniture. Obviously, in the last few years, a lot of push has been towards soft seating and flexible seating. Well, if some of those elements aren't as easily cleanable and able to be disinfected, then we may want to look at discontinuing use of those items, at least for a while. Food service, I think Neil had touched on earlier, but considerations like kids bringing their own meals or limiting the number of choices or maybe limiting what's served to prepackaged items. In some cases, we've got districts that are looking at students eating in their classrooms instead of congregating out in the large groups in the cafeteria spaces. Occupant flow, I think, is something that should also be considered. Things as simple as staggering arrival and dismissal times and trying to avoid mixing of those large groups, at the beginning of end of day is a big deal. When we look at the way certain buildings are configured, considering going to one-way travel within the buildings and almost creating one-way loops within the corridors, again, to avoid that cross traffic and the mixing of airstreams and so on. To touch on administrative or staffing spaces, one of the key areas there that we've been talking about are how you're setting up your health areas and your nursing areas. Things as simple as where daily medications are distributed to kids, right? And does that want to happen in the nurse's office now, or does that want to be relocated to somewhere else in the building where it's less likely to cross students that are just trying to get their daily meds with someone who might have symptoms or be suffering from something. Plumbing and water systems, considering not using any of the shared drinking fountains for the year and turning those off. Depending on the configurations in some of your larger bathrooms, gang bathrooms, considering installing flexible barricades between the sinks if the sinks are configured to be too close to each other. That's something that can certainly be impactful. We've even seen districts going to lengths, as extreme as touchless faucets, touchless towel dispensers, those types of things. Obviously, some of those measures are going to come with costs, and so the viability of considerations like that is something that each district's going to really have to evaluate on their own. And last but certainly not least, HVAC, and this will undoubtedly be one of the most impactful ways to try to set up your facilities to be as safe and healthy as possible, but it's also one of the most complex areas. Clearly, there's a broad variety of system types and complexities and conditions and ages out there within our facilities, and how those are controlled, how they're operated, varies greatly even within a single building from space to space. So one of the things I guess I'd start with, and that we can't stress enough when it comes to the ventilation systems, are that yes, they will be a very effective way of helping our situation, but any modifications or adjustments to those systems are going to be vulnerable to creating negative impacts and issues within your buildings. And so we really encourage you to reach out to, whether it's a qualified engineer or HVAC systems professional, whoever it may be. We've really got to make sure that you're running proposed changes by someone who can help you evaluate how things might be impacted down the road. General focus related to ventilation is really to increase the number of air changes to the extent possible. It's really a matter of trying to dilute any airborne contaminants. Again, the way to extend things is really to try to maximize the amount of outside air, maximize the dilution rates, but doing so that you're not having significant impacts on either occupant comfort or temperatures or acceptable humidity levels. Obviously, the inability to control some of those things can lead to some really bad things happening within buildings with moisture, et cetera, and we don't want to go there. So again, just to summarize quickly here, I think appropriate solutions are going to want to be evaluated on their own merits based on your unique situations. HVAC is clearly going to play a big role in that, but again, we're encouraging you to run that by professionals to help you analyze the appropriateness of those changes. So I think next on the docket might be Chris talking a little bit about transportation.
Thanks, Pat. Another area that districts will have to deal with operations is obviously transportation. As part of that, Neil mentioned safe drivers. Bus drivers tend to be, in that older age range. Making sure that they're safe. Does that mean that they're wearing masks and gloves and taking those appropriate precautions? Safe and clean ride. Are we wiping down the buses before and after a route that's completed? Was in a presentation last night, actually. One of the recommendations I think that's possibly coming out is looking at keeping the windows down in a bus. Now in Minnesota, obviously with our climate, that isn't always necessarily a realistic thing, but that's another consideration. How do we get the air to change over inside a closed vehicle that's traveling with kids in it? Safe and clean bus garage, somewhat tied to what Pat talked about. Making sure that the HVAC systems are operating at their optimal range. But also making sure that we have cleaning procedures in place that we have a clean and we're mitigating those risks in that space. Potential procedures to implement to ensure safe drivers. Drivers, as I mentioned, possibly wearing masks and gloves. When you're sick, staying home, making sure you have that protocol in place. Are you taking temperatures and answering a questionnaire when drivers come into work? Just again, making sure you have that next level of protocols in place to safeguard everyone from the pandemic. Possibly, oh, I mentioned that one as well. So districts should consider other potential drivers in districts. So this is a big one, because if in the event you have a driver or two go down, who steps in to take that bus route? You now have a bus that potentially doesn't have a driver. So coming up with backup plans in terms of how you're going to address that as well.
So just we'll just some calls to action, and then we'll probably jump also into the question and answer part of the presentation here. So again, if anybody's interested in testing out a hybrid model case study, you can reach out to me directly through email. Again, we can only probably handle a few districts just because it's going to take a lot of time. We're thinking it'll take us probably a good 3 to 4 weeks to work with the district to put together all the pieces to this puzzle. So reach out to me and we'll try to do the best we can. District stakeholder survey, that was one of the things Todd mentioned. If you're interested in that, he's got examples of the surveys that you can use. You can reach out to him. And then in terms of any of the HVAC or ventilation modifications that you're making, as you know, we do have our entire technical services team that deals with HVACs on a regular basis. If you do want to reach out to him and just pass things by Dana or his team, again, you know, nobody's going to have the resources to go visit every single building out there and make those adjustments. But Dana and his team has the capability to log on and try to help you guys out and make sure that any decisions you're making to bring in a lot more outdoor air, you know, demand control ventilation. As you know, a lot of school districts have gone to do demand control ventilation, which is going to be a real problem as you bring kids back. Just reach out to him through email. He'll be able to respond to you and provide more guidance. And again, in July, we'll be covering a lot of these things in a lot more detail. And I think that'll also be helpful as we go forward. So we'll have a final comprehensive playbook ready in mid-July. Topic seminars, we are thinking that we need to cover in more detail. We've kind of laid those out here around the educational hybrid and cycle lend tool, detailed policies and procedures, facility modifications, transportation. So we're going to bring in kind of subject matter experts around these pieces and the playbook component of that, and then go over that in more detail. And of course, how to engage your community and how to communicate with them, and any other topics that need to be covered. We are going to be sending out a survey. So part of the reason for that survey is to help us determine what those breakout sessions are that you think would be valuable. Because again, those will also run about an hour and a half, but they're going to go to a specific topic and go much deeper into it. And then combine links and resources available at the end of the presentation so that you can go directly to those and get more additional information that you need. So with that, we'll move to the Q&A session. So if Aaron, if you could maybe go through those, and if any of you are still on the call, I think most of you are still on. If you have any questions, just put those in the chat room. Aaron will review those and we'll go over that and make sure we pass it on to the right subject matter expert to answer those. So Aaron, if you can maybe kick that off. Thank you.
Sure. This is Erin Sorensen with ICS. The first question is about when and where this presentation will be made available. After this call, an email will be sent to the email you used to register for this webinar with a link to the short survey that Arif mentioned, as well as a link to our website where you can access the slide deck, audio and video recordings of our webinars, and more information. So be on the lookout for that here shortly. The first question I will direct towards Seamus. Can you provide an example of the emergency resolution you are suggesting?
I can. I don't think I don't think it would. The resolution is going to be short and sweet. It might have some whereases in it. As a lawyer, you have to have a whereas to make it, you know, official, right? But the resolution is going to reference the national declaration by the U.S. government. It's going to reference the state declarations here, as well as some of the applicable emergency orders of the governor. And then that in turn will create an action through the resolution for the board to act in its discretion to implement the policies that are impacted by the COVID-19 pandemic. So it's pretty short and sweet. It's 3 or 4 paragraphs, and I'm happy to send a sample template out to anyone that wants it. All you have to do is email me.
Thank you, Seamus. Neil, I'll direct this question at you. I heard that the disposable surgical masks are good because they are electrically charged. Is that true?
They aren't very good. If you use a disposable surgical mask, you need to have an ear saver on it to make it tighter to your face, because the disposable surgical mask, particularly with loop, will have a gap around here. The protection factor on it is probably around 2 to 4, and for an N95, it's at 100. So that'll give you a variation on it. So if you pull it really tight to your face and it's really sealed tight, you can probably get a protection factor around 6 to 12. But we've got a real problem with respiratory protection, and we aren't where we need to be. And we need to think about creatively about getting better protection available, possibly using some respirators that cannot be used by healthcare workers, N95 with exhalation valves, other things, and we have to figure out how to protect other people with that. But the surgical mask is not very good. It's sometimes it's just a little bit better than a cloth mask, but not much.
Thanks, Neil. The next question I will also maybe direct at either you or Pat. The question is, can you talk about touchless water dispensers to refill water bottles?
I think it's a good idea. You don't, as long as it's not a congregate area, I don't see any big problems with it. Pat may have a different perspective.
No, and everything, yeah, I would agree with that. And everything we've been researching and pulling together, the touchless ones are certainly preferred over anything that you're having to push the bottle against. There've been definite, cross-contamination concerns with any of them that are more manual, but the touchless ones seem to, everything we've seen, people are still okay with those remaining in service.
Thanks, guys. The last question is for you, Arif. Would CARES Act grants cover health screening / others within school districts?
Yeah, that's a very good question, and it's pretty specific in terms of whether it covers school districts or not. I know that there's some state funding and federal funding that's coming in through that CARES Act. Let's do that one. We can take that offline. I think we'll have to do a little bit of research on that, and we'll include that. We can include that in our PowerPoint too, in the notes section, so that they know what the next step are. It's a good question. I don't have an answer. I don't know if anybody else on this panel has any answers around that in terms of funding, leveraging that with the CARES Act. I can tell you though that the Health and Safety Levy Authority and some of the funding that's available for school districts, the masks for both staff and for students can be covered under health and safety funding. There was some concern about whether the other costs associated with, for example, purchasing, sanitization stuff, all that kind of stuff. There's a whole list of things that you need to purchase, whether those would be covered or not. And then the third piece is the dividers. We know that a lot of school districts are working with, we are going to have to put in some dividers, those kind of things. That's going to be challenging in terms of how you cover the cost, because it's not cheap. It's pretty expensive to do that. My understanding is that at this point, and it may change, that masks are covered and potential modifications to your facilities due to this specific issue could be covered under LTFM with the long-term facility maintenance funding model. We still don't have an answer yet, final, on some of the other materials that you're going to have to purchase. again, I think that it is pretty clear that this is a health and safety issue, and those costs should be covered rather than you covering it under your general operational budget. So we'll dig into that further to find out, but I don't know if anybody else on the panel has any clarification on the CARES Act. Okay, we'll get you more information on that.
Arif, we've had a few additional questions come in. It is 9:29 at the moment. Do we want to continue, or do we want to follow up with a specific FAQ section after this?
I think if we have a few more, we'll just cover that quick before we jump off.
Okay. One of the questions we have, will you be addressing typical office setting / activities such as using the copy machine, staff restrooms and workroom / lunchroom, central coffee pot and water coolers?
Yeah, we will have that. So I think in the playbook, you'll see there will be a section talking about those kind of things in terms of how they should be used and what the protocol is. So that will be included.
Okay. Next question, can we outline the safety protocol for a hot lunch program? I'm assuming that would be a breakout session, correct?
Yeah, that's actually a good question, because I know we did not address that specifically, but maybe we'll have one for food experts, talk to him about that and try to put that in there. So I think that'll be good.
Okay.
You can make a note of that, because I think that's a good point. We kind of looked at it. I think this team looked at it more about different ways of serving lunch, but I think what if we do put the right safety protocol around that? Could we provide hot lunches, and what's the process for that? So.
Next question, is there guidance on covers for electronic devices such as copy machines to protect electronics from cleaning?
I don't know that. Anybody else? It's interesting. Covers. Okay. We will dig into that too. Good questions.
Neil, I have a question for you. If using cloth masks, is the 3 rubber band hack accurate?
Come again, 3 rubber band?
Yeah, I'm not, that's what the question asked. And Mindy, maybe you could provide additional clarification either in audio form or in the chat. If using cloth masks, is the 3 rubber band hack accurate?
Here's what we're finding on cloth masks, and I can take the discussion offline, and I can forward on if people want when we get the publication done from the Masters of Public Health student that's working on it. Very complicated issue. It has to do with materials, it has to do with face fit, and it also has to do with breathability. Also working on a research project for essentially a mini PAPR that might be very helpful for some people, and I've just got some equipment and I'm playing around with it, but I think that would be a real game changer if we can get to that. But right now we've got a real problem with masks. I think Mike Osterholm has talked to that specifically, and I don't think the 3 rubber band solution is going to help it. If we could have everybody in a PAPR, we would have a really nice time. We can't do that. We can't have people wearing N95 surgical masks because we don't have enough of them. We're 1 million short in the state of Minnesota. So this is a huge issue that we have to deal with. The cloth masks are somewhat helpful, but only for a short period of time. And then after that, we're all breathing the same air.
Okay, thanks, Neil. There was a comment about, I thought drinking fountains were required by Chapter 29 of the Building Code. So maybe a spin-off of that question is what rules within the facilities are perhaps exempt moving forward because of COVID-19?
It should be a Chris Zemer. Chris, are you on?
Sorry about that. Can you repeat the question, Aaron?
I thought drinking fountains were required by Chapter 29 of the Building Code. So a spin-off to that would be what facility rules are potentially exempt moving forward.
They are. I don't think we've gotten any guidance from the state in terms of looking the other way in terms of building code right now. But it is something that's going to have to be addressed, obviously.
Okay. So maybe that's a note, Aaron, that we can, I know it's been challenging for us even to have those conversations with the code people, but maybe we can send them a note out and see how their response is, because clearly these are CDC guidelines in terms of what we need to do, and they may supersede the building codes, but I'm not sure.
Well, and I would jump in on that as well. If you know, whether it's the building code related to drinking fountains or some of the energy codes related to the ventilation systems or so on, clearly we're in an unprecedented, you know, situation right now, and I've got to believe that some of those jurisdictions are going to have lenience when it comes to either over-airing buildings or dealing with, you know, disinfection or cleaning issues related to drinking fountains and those kinds of things. So I guess I'd err on the side of common sense at this point, and hope that people realize the situation we're in.
Okay. So I think let's do this, Aaron. I know we are out of time and some of the presenters have to jump off too here. So if there are any other questions that we haven't answered, we'll make sure we get those answered and get you the information back. And then please, if you get a chance, if you could complete the survey, it'll really help us determine not only what other breakout sessions we need to have, but then also maybe certain specific components or topics that need to be covered in the breakout sessions. If you could do that, much appreciated. Again, for all the panelists, all the presenters, the task force that's been working on this since April, thank you for all the time and effort. I think we still have a little bit more work to do to get everything finalized and move this thing forward. Have a great Friday and have a great weekend. Take care, everyone.